Welcome, Melissa.
Thank you. Thank you very much. So I wanted to start by introducing what FAO does. And we are a specialized agency of the United Nations. And we are leading international efforts to defeat hunger and malnutrition around the world. And our goal is to achieve food security for all and make sure that people have regular access to enough high quality food to achieve healthy and active lives. We have 195 members, which are 194 countries plus the European Union. And we work with over 130 countries around the world. So in this big organization, we have a quite modest group that work in something that we call the School Food and Nutrition. And it's basically, this is our framework for action. And yesterday we were talking about the millions of frameworks that we have now and how we are trying to reconcile all these types of frameworks in order to enact change. So this is ours to add to the plethora of frameworks that exist. And basically, what this, for us, this is how we organize the different areas that we do based on our comparative advantage. So we support countries mainly in 4 areas that interact with each other. One is inclusive procurement and the value chain development. So we support smallholder farmers to access school meal markets through changes in policies, legislation, agricultural development support, and many other aspects. We also support countries in legislation to support healthier food environments and, of course, more nutritious school food. We also have developed a framework and guidance for supporting different ministries of education to actually integrate food education into their curriculum. And of course, we work in the broader enabling policy, institutional and legal environment. And we have many cross-cutting issues, as you see here in the graph. But basically what we do is that we translate evidence, so everything that we are listening here, into policy and programmatic support for many countries and also into normative guidance. So I think I am in the right place at the moment. So today I want to talk to you about one project. We have a global project that we want to support different countries on the process or a methodology that we hope to validate with experts on the steps or the know-how to develop nutrition standards and guidelines for their school meal programs. But we have many, many challenges. So these are just a few, and I think everybody here has touched upon one or the other. But this is what we have to deal with when trying to create this global methodology that fits to different countries. So we first have to understand that there are many, many programs, school meal programs around the world, from the very centralized to the very decentralized. We deal with everything from providing children with fortified snacks to very diversified meals that change every day in 4-week cycles. We go from caterers, very small caterers, to cooks that are not paid, that are parents of children that do this for free, to very institutionalized catering systems. So we have the whole range of things that we have to consider. We have made some assessments of what the majority of countries have as their nutrition standards, and we have seen that there are a lot of blanket recommendations for all countries. And it's very funny because we have seen this recommendation of meals covering at least 30% of children's requirements of energy, protein, and specific micronutrients. And we wanted to go to the source of where this recommendation came from because we couldn't find it. And at some point it was called global recommendations, but we couldn't understand the source or the reference. And we found that it came from a conference, a small conference, many years ago, and was a recommendation of one of the presentations. So you see, this is how the recommendation was born. So now we are trying to see how we can go away from blanket recommendations into more holistic approach of how the meals should be developed. We have seen here that there is a lot of data in some countries, but there is extremely little data in other countries. And in the majority of the countries where we work with, they have a lot of data in the capital regions. They have a lot of data from different universities around the world that have research there, but it's very little, it's very, is lack of disaggregated data. We don't have data on specific regions, often the most vulnerable regions of the countries. And I was talking to some of you here, and apparently this is not only the case in low and middle income countries. We have the challenge of integrating objectives in these standards and guidelines that are not only nutrition, but also sustainability, but also many countries, they are focused more on agricultural development rather than on the nutrition of school children. So we really have this immense challenge of not only focusing on particularly only nutrition. There is no validated indicators at global level that we can see to first understand compliance and adherence. And this comes from the talk that we had the other day on the implementation and compliance with standards. We had no validated or globally comparable indicators to see what is the impact of such standards on children's diets. And we have also problems in how these standards are developed, how they're implemented. Sometimes they're developed by the Ministry of Health or by health experts or even by experts from academia, but normally they're not communicating with those that have to translate that or implement that. They're not communicating with Ministry of Agriculture to understand if the supply is actually feasible for what we want. Sometimes they don't communicate with Ministry of Education that needs to actually implement and monitor. So we have these issues as well. And also a disconnect between national level recommendations and local recommendations that in many cases is very difficult for specific regions for one reason or the other to comply with national standards. Of course, we talked about inequality today. How do we ensure that national standards are not only serving the healthy child or the child that has this baseline nutrition status, while we are maybe disregarding children that are very vulnerable nutritionally and also socioeconomically. We have supply and budget issues, that this is the main problem that we have in countries for implementing nutrition standards. How can we ensure a nutritious meal for children if we cannot even ensure a continuous supply for the staple of the meal? We have, of course, crisis now, COVID-19. We have other crises with prices, food prices, the Ukraine war, all of this that is hiking up prices, and the governments are not managing to really support the children with the school meals. We also have focus, many times we are talking one language, and as we are saying with the colleagues today, others along the chain of what it is school food are talking another language. We're talking about nutrition recommendation and standards, but people in the procurement side or the supply side are talking, okay, what does this mean in food? Tell me how much do I need to procure, and tell me where from and how. And sometimes in this situation, we focus a lot on specific foods and not on diets. So the problem that we have is that we end up creating additional problems where we wanted to seek solutions. So for instance, in some of the countries, we want to integrate something as simple as integrating fruit in the school meal because children are often not, they don't have available at home. And sometimes we end up with, okay, the only solution that we have is we're going to give them oranges, but the oranges cannot be produced locally. So we're going to export oranges, and we're going to give them oranges every single day. So sometimes we now caused a supply chain issue that we did not consider in the beginning. So it's in some countries, the school meal program is a huge market. And if we make changes in some little things that we thought, oh, this is for the nutrition purposes, we are somehow causing problems in the supply chain. Now we have the issue of biodiversity. There is more and more push of including biodiversity considerations into the school meals. So as you see, what I'm going here is that sometimes we see school meals as the panacea and the solution of all the problems that we have in the food system. And it's quite difficult to really pragmatically achieve that. Another situation that we are dealing with is, should these nutrition guidelines and standards be compulsory? Should they be in legislation? How, if they are in legislation, which normally we think is a good thing because that doesn't depend on change of governments, but if we include it in legislation, how do we ensure that there is compliance? And do we really punish people for not being able to comply with them if they don't receive the payments on time from the governments, from the municipalities? So really, how do we handle all of this? We've seen and we heard a lot about trainings, capacity development, we call it capacity development, of caterers, food service staff, teachers, frontline teachers, but sometimes there is a lot of pressure on them. Why are we putting all of this pressure on them and we're not acting at the policy, at the enabling environment level? So, and then when we act at the policy and the enabling environment level, we say, well, but we need to train the teachers and we need to train the staff. So it's quite complicated. Another thing, and I think everybody has mentioned it here, is that we aim to have the perfect meal in some cases, and the children, they need to eat it. Sometimes the preference is for all the other foods that are around the meal, the so-called competitive foods. So there are many, we have come into countries, and I don't know if you're familiar with this Global Child Nutrition Foundation survey that I'm sure some of you have filled out for your countries. And basically, it's a survey where you check everything that you have in your school system. Policies on regulating the food environment or the competitive foods, school meal programs, legislation, etc. But then when you really go to see what those qualitative indicators mean, you see that the policies are not being implemented. They're not talking to each other. They're promoting on one hand, on some schools this, and in some other schools another thing. So how do we make sense of the picture at national level? We had these wonderful students yesterday, and more we are trying to co-create the whole process with the actual students that will eat the meal. But sometimes we end up having representatives of students that are very well-mannered, well-spoken, have very good education, but how do we reach the most vulnerable? How do we consult with them? It's quite difficult to reach them in a meaningful way. Today is all about social and cultural aspects, so I will just not go into that. The culinary perspective. Here, I think it's very rich, the culinary part of the school meals. In other countries, much less. It's about filling bellies, let's say. So how do we ensure that we are supporting also the taste aspect of the meals when we are talking about standards? And we're also here today because we want to ensure that we're making linkages with all of you, and that all the aspects that we cannot consider at the programmatic or policy level, and all the evidence gaps that we have are adequately communicated to academia so that we can talk to each other and work with what we need. And of course, the linkages with the home diet. In many cases, we create a very good environment in the school, very bubble-like, let's say, but what happens in the home? What happens if they don't have any other food to eat? What happens if they do have a lot of food to eat? How do we model healthy diets on one country, but then support hunger in another one? And We are supposed to not reinvent the wheel, but stay innovative and have new things all the time. So this is what we are mostly dealing with in our daily work. And well, finally, this is what this project wants to do. Do we provide the best possible meal with what we have in the countries? Or do we invest in changing the system and help us provide the best optimal meal? This is the boring part. This is the project characteristics. We have 3 to 4 years to achieve this purpose of this methodology. And we're working with sister UN agencies, with the World Food Program, UNICEF, WHO, and many other organizations. And as I mentioned, this is a global project, but we have 2 countries where we're going to test this methodology, in Cambodia and in Ghana. So what are the main deliverables of the project? As I mentioned, we want a global methodology. We want it, of course, to be evidence-informed. We want it to be food system-based, and that means basically that we are not only considering data from the nutrition of school children, but we're also considering data from the supply side, the food environment side, what is possible in the value chain development. We are considering data on the sociocultural aspects of food, the meanings of food, the traditions around the countries. So we want to make it food system based in that instance, and we are following a food systems approach. So considering food supply, food environment, consumers, the children, and all the other aspects around. We want it to be holistic in a way that is not only focusing on the core nutrition aspects, but we are also considering sociocultural aspects, environmental aspects, and also sustainability considerations. And transparent, we want to ensure that it addresses conflicts of interest of those who participate in the process, so that it's not, let's say, duly informed by other pressures or commercial pressures. And of course, if it's a global methodology, it needs to be adaptable to the country. So this is what we are aiming at. Something that I'm here today, and I'm very excited about that, is that we are having a global platform, and we are having a country database where we are asking country focal points to share their experiences on school food and nutrition education, or food education, as we call it here, to share with other countries around the world. So we have already reached out to some Nordic countries, and we are also having these key informant interviews with focal points in order to ensure that other countries know what has already happened, so that they don't reinvent the wheel as well. We have a research component in those 2 countries that will pilot the methodology, and we will have an intervention where we will test the standards on new school meals versus the meals that they already received, and then we will see what happens with their diets. And we have a qualitative aspect, which it's very interesting, and we are going to have all sorts of different actors interviewed, focus group discussions, hopefully photo voice, to understand what is the dynamics around the meals, and also what the relationship between the meals and the house. We are supporting capacity development not only of those who will implement the standards, but those who will design them, those who will monitor them, parents, and also children. And then this is something very difficult sometimes, because we are advocating to governments for the recognition of the right to food, the right to adequate food of children and adolescents. So it's a human rights-based approach. And what we are doing is considering this holistic approach to school food as one of the instruments to support the right to food of children and adolescents. So in some cases, this goes very well. In some others, it doesn't. I have 2 more minutes, yes. So this is our theory of change. And since I have 2 minutes, I will not go into it, but I will be very happy to share with you after this. And this is how we think the project will create our medium-term outcomes and goals. This is one of the, we are still developing the methodology, And I'm very happy to be here because I have already gotten so many new aspects that we need to consider. And basically, this is just a summary of what I mentioned before, of how we're integrating different types of data into decision-making processes. We're having different types of inputs into the process. So what are the competitive foods? Are there national dietary guidelines in the country? What are the regional food patterns, the sociocultural norms related to food, environmental, social, and economic sustainability considerations, and other types of information that we need to consider in the decision-making process. Along with the methodology, we are also developing normative guidance in food education, food environment coherence, procurement aspects, and how to integrate these holistic nutrition standards into policy and/or legislation. And this goes back to getting information from different systematic reviews, from different types of studies that we are reviewing at the moment, in order to translate this into actual feasible guidance for countries. So where are we now? Now we are in the assessment and data collection phases in both countries. We are having these key informant interviews that I mentioned with country focal points, so I will reach out to some of you as well if we have some gaps. We're reviewing evidence, developing the methodology and these manuals. We are also creating technical webinars that are global, where we are sharing good practices of countries to share with each other. We have only had one at the moment on policy, but we are going to have the next one on food environments and how we need to ensure coherence between what happens in the food environment, actually. We're reaching out to researchers from multiple areas, so hence me here today, which is quite good because we have you all in one room. And most importantly, we're trying to define criteria of what is a best practice or what is a good practice. We have so many things from very localized that maybe cannot be translated to other situations. So how do we define these criteria that we want to export to the world, the principles of good practices? What do we really want to share? And I just want to finalize by inviting all of you to join the Research Consortium for School Health and Nutrition. This is basically an international consortium where researchers are getting together and are really focusing on the evidence gaps that we have. And they're generating evidence on all sorts of aspects of school health and nutrition programs, a little bit broader than school meals, and with a concrete focus of informing policy and program. And they have different communities of practice that you can join. They have one on evidence and impact of school meal programs, analytics and metrics, good examples, the one that I was mentioning, and indicators for nutrition of the school children, which we still don't have globally validated indicators for their health and nutrition status. And this is just one of the examples of the normative guidance that we have developed so far. If you're interested also, I can share with you these resources. And just an example of the countries that we work with. And yeah, we're very happy to keep exchanging and to learn from you as well. Thank you very much.